Here's a question for you. Should insurance companies have more say-so than your doctor to decide what's medically best for you? Physicians are often required to get permission from insurance companies before providing health care. This is called prior authorization. And the Texas Medical Association hopes lawmakers will address this process by passing several bills this legislative session. So we invited Dr. Zeke Silva, the chair of TMA's Council on Legislation, to come on Midday to help us understand and discuss this issue. Welcome, first of all.
Thanks for having me.
We appreciate your time. And so what are doctors seeing as a result of increased use of prior authorization?
When we think of prior authorization, and you accurately characterize it, it's approval after a treatment has been decided by both the physician and the patient. 92% of physicians report that prior authorization results in delays of care. 82% report complete abandonment of care. So there's certainly a challenge and an opportunity here in the best interest of patients and the physicians who serve them.
And Dr. Silva, what does that mean? So a patient can wait weeks or months before getting the treatment that you said they needed?
Indeed, and during that period of time, the physicians have to reach out to the insurance companies to gain approval for treatments that they believe are medically necessary and appropriate. The patients themselves have to wait to start their treatment. And you can imagine a patient that's in a difficult circumstance is ready to get better, and this delays that ability.
Yeah, they've been in pain and they want some remedy.
Indeed.
All right, so let's talk about some of the legislation. We're going to start with Senate Bill 177. What does this bill do?
That's a bill that prohibits insurers from using autonomous systems. Imagine an artificial intelligence system that scrubs the medical record to deny care.
So not even a person?
Not even a human. Not even a human, an automated system. We believe that physicians are best positioned based on our training, our commitment, and our experience to inform care. When machines override that and there's not a human in the loop, the potential downsides, I think, are obvious.
Yeah, you guys are the expert. Okay, let's move on to SB 547. What does this one do?
In 2021, we were able to pass legislation so physicians who had common circumstances where they're exempt from prior authorization would have a gold card going forward. In other words, they would not have to pursue prior authorization for new patients and new treatments. Regrettably, the effects of that have been limited. So our goal here is to increase transparency. So the Texas Department of Insurance has better awareness of which physicians are exempt and a better understanding of why physicians are not given those exemptions.
Let's move on to SB 1380. What does this one do?
This is an important bill because what this bill does is it exempts common conditions that would otherwise may require prior authorization. So think of preventive care, think of screenings, think of patients with chronic diseases that they're frequently having to ask for prior authorization for the same treatment that they've had for years. You can imagine the delays and frustration that would cause.
And these are just 3 bills we're talking about. There are several others TMA is sponsoring and hoping that lawmakers get their attention, right? So.
Indeed. In fact, one would require that prior authorization, those that are evaluating it, would be available 24 hours. Patients feel the effects of prior authorization 24/7. And if that's the case, we think that those that are limiting care should also be available 24/7.
Yeah, because the emergencies don't happen 9 to 5,
They
right?
do not. Medical care is a 24-hour business, and we as physicians want to do the best job possible, and that is a 24-hour responsibility.
Dr. Zeke Silva, thank you so much for coming in and enlightening us about what the TMA is doing.
Jenny, it's been an honor. Thanks for having us.